Dental cleaning is an important part of your pet's overall health. Some reasons to clean your pet's teeth include bad breath. Dental disease can be painful and can lead to lost teeth. Mouth infections can spread to your pet's vital organs. Dental infections can actually lead to a shortened lifespan. Some signs of periodontal disease are teeth that have tartar or dark calculus buildup, swollen, red, bleeding gums, persistent bad breath, or a resistance to play with chew toys or drink cold water. North Shore Animal Hospital is an American Animal Hospital Association, or AAHA, accredited hospital. That means we are one of only 15% of animal hospitals in the United States and Canada that have been recognized for our commitment to maintaining high standards of care. Zippy is going to have her teeth cleaned today. Before she even comes in the building, the doctor who will be supervising her dental procedure reviews her medical records, medical history, and blood work results to be sure she is healthy and a good candidate for the procedure and anesthetic. Zippy's mom brings her in and discusses the patient intake paperwork with one of our certified technicians, who will ensure that Zippy is all ready for her dental procedure today and that her mom has no questions. We normally ask that you allow 10 to 15 minutes for dental patient admittance. Zippy had her pre-surgical blood work run ahead of time and testing it with our in-house laboratory today. Pre-surgical blood work is important because it's our only way of assessing kidney and liver function. Anesthetic is metabolized by the kidneys and liver, so it is important to know they are functioning properly. One of our certified veterinary technicians will place an IV catheter for fluid administration during the procedure, which also assists in maintaining good blood pressure and kidney perfusion. The doctor examines Zippy, listening to her heart, checking her color, feeling her lymph nodes, checking her abdomen, taking her pulse and respiration to ensure she is healthy enough for anesthetic today. Premedication is administered, which relaxes Zippy, gives preemptive pain relief, and lessens anesthetic gas requirements during surgery. Zippy is given an injection to sedate her enough that we can place the endotracheal tube. One of our certified veterinary technicians cleans her teeth while another veterinary technician monitors her vital signs the whole time she's under anesthetic. The doctor stays available to evaluate teeth or x-rays, and in the unlikely case that there is an emergency. The ultrasonic cleaner is used to remove tartar below and above the gum line of Zippy's teeth. Note the water warming blanket under Zippy, as well as the bean bag and blanket. These are to keep her body at an appropriate temperature. Zippy's teeth are polished with our high-speed polisher. This smooths the teeth and helps prevent premature tartar reformation. Zippy's teeth are treated with fluoride. Although animals don't get cavities as often as humans, fluoride has been found to help strengthen their teeth. The veterinarian evaluates Zippy's teeth to ensure no extractions or periodontal treatments are indicated. Radiographs are taken if teeth are missing, broken, or if there is a deep gingival pocket or significant gingivitis on a tooth. We extract teeth if indicated based on the x-ray results and condition of the tooth. For instance, if a tooth is loose, has a cavity, is broken with root exposure, or if the gums are in poor condition. Local anesthetic is often used on more involved extractions. After the dental procedure is done and our patient is recovering, vital signs, pain, and stress levels are monitored by the CVT while the pet wakes up and at regular scheduled intervals throughout the afternoon until she is ready to go home. Pets are normally ready to be picked up between 4 p.m. and 5:30 p.m., but each pet is an individual and we send them home based on their recovery and on how ready they are to go home. Home care is important. It will help increase the time between professional cleanings and will keep your pet's mouth healthy longer. We are happy to answer any questions you have at North Shore Animal Hospital. Please feel free to call us. Pickles, Luna, and Lizzie are going to be spayed today. Before they even come in the building, the doctor who will be performing surgery reviews their medical records, medical history, and blood work results to be sure they are healthy and good candidates for surgery and anesthetic. Their mom brings them in and discusses the patient intake paperwork with one of our certified technicians who will ensure that the kittens are ready for their surgeries today and that their mom has no questions. We ask that you allow 10 to 15 minutes for surgery patient admittance. Because North Shore Animal Hospital is a feline-friendly and fear-free practice, the kittens are placed in cages with towels that have been sprayed with Feliway. Blood work will be drawn and run in our in-house laboratory if not done previously. Pre-surgical blood work is important because it is our only way of assessing kidney and liver function. Anesthetic is metabolized by the kidneys and liver, so it is important to know they are functioning properly. The doctor examines each patient before surgery, listening to their hearts, checking their color, feeling their lymph nodes, palpating their abdomens, taking their pulse and respiration to ensure they are healthy enough for anesthetic today. Each patient is given a pain score indicating what their level of pain is at that moment. Each patient's pain level is monitored throughout the day as they have surgery and as they recover. It is our goal to minimize pain and anxiety pets can feel related to surgical procedures. We do this by monitoring them carefully and by using multiple modes of pain and anxiety relief. Patients are given an injection to sedate them enough so that we can place the endotracheal tube. The endotracheal tube is used for delivery of oxygen and gas during the procedure. One of our certified veterinary technicians places an IV catheter, which is used for fluid administration during the procedure and helps to assist in maintaining good blood pressure and kidney perfusion, and also gives an open line in the unlikely event there is an emergency and the doctor needs to give medication right away. A certified veterinary technician monitors the pet the entire time they are under anesthetic. In addition, there are electronic monitors on each patient that are monitoring blood pressure, temperature, pulse, oxygenation, respiratory rate, and heart rate. Note the water warming blanket under our patient as well as the beanbag and blanket. These are to help keep her body temperature at an appropriate level, as anesthetic can drop or reduce body temperature. Sterile procedure is used for a patient's spay surgery. We do surgical preparation like shaving and special scrubbing in a separate area, and then move the patients into the special surgery room that we use specifically for surgery. Our surgery room is used only for sterile surgery, and the doctor and technician wear gloves, caps, masks, and gowns to help minimize contamination. We use sterile surgery technique, which involves drapes and specific ways of handling the patient and equipment. After the surgery is done and our patient is recovering, vital signs, pain, and stress levels are monitored by certified veterinary technicians while the pet is waking up and at regular intervals throughout the afternoon until they are ready to go home. Depending on which procedure was done, patients are discharged either in the late afternoon, early evening of surgery, or the next day. Our technicians will go over the specific post-surgery instructions with you as well as give you written instructions. Your pet will likely have pain medication to go home with unless we have given a long-acting pain injection. We are happy to answer any questions you have about surgery at North Shore Animal Hospital. Please feel free to call us.